So the reason you got injured in the first place is because the tissue, whether it was like your tendon or it was muscle, it was not strong enough to tolerate the load you put on it. Therefore, you got injured.
Welcome to Athlete's Edge with Doc Dolly.
Smith grabs the puck and scores!
Providing athletes with a scientific edge in achieving goals and optimizing performance. We bring in expert healthcare practitioners and high-performing athletes to share case studies, cutting-edge research, and their invaluable knowledge.
Had him dead to rights. McDonough cross. They score! Nikita Kucherov!
Whether you're looking to enhance your training, prevent injuries, or reach new heights in your sport, you're in the right place. Let's introduce your host, from Rhinelander, Wisconsin, former collegiate athlete and owner of Motivation Health and Wellness, Dr. Jayson Dahlquist.
They score! It goes in!
Welcome back to another podcast, guys. Today, we are diving into everything about recurring injuries and endurance, specifically with running athletes. And I have Dr. Brooke Ayers here. She is an ex-D1 athlete turned physical therapist. And we're going to dive into her story and get her talking all about reoccurring injuries and kind of how to overcome them. So thank you, Brooke, for joining us on the podcast today.
Yeah, thanks for having me.
Yeah, how are things going?
Going good. Yeah, busy with work. I currently work in an outpatient ortho clinic, and so I see a lot of things. I'm working 40 hours and just kind of getting my reps in as a PT and learning a lot.
That's good. So bring us back into your athletic era as a D1 running athlete.
Yeah, so I went to college in Nashville, Tennessee. It was a small Division I school called Lipscomb University, and I was an endurance athlete. The longer the distance, the better. Shout out to Lipscomb, actually. Right now, they placed 11th in the NCAA last year, their women's cross-country team. They beat schools I think they beat like UW and other top D1 schools. So
No kidding.
their distance running team is incredible. They weren't as good when I was there, but we were on the rise. So yeah, I ran there. I had a really good experience. I had a coach my last year there that he had been recently hired that had been a sports scientist for USATF, and his name was Coach Polk. Shout out Coach Polk. He was the best. He taught me a lot about just like exercise physiology and how to best adapt to training. And my PT brain was just in love with that. I love all things like sports science and physiology. We did a lot of exercise or workouts where I would get like my lactate tested, my blood lactate. I'd do a rep and we'd retest it. By the end of the workout, my finger would be super bloody, but we would learn how to modify my training to find my lactate threshold and plan my workouts according to that. And we worked together to kind of just help me become best athlete I could be. And, you know, it was a really good experience. I loved my teammates and I loved running. So, yeah, I mean, I think there was times where I had some injuries that would set me back, but overall it was a good experience. And I'm thankful for the time I had there.
Was that undergrad or were you in PT school at that point?
That was undergrad, yeah. So undergrad, Nashville, PT school, USC.
USC.
From Washington, though.
Okay.
Yeah.
Yeah, well, because you're back there now, Seattle.
Mm-hmm. Yep.
Yeah. Talk us through the whole lactate threshold thing. Keep it simple with more of the testing. What do they use? Because they talk about like finger pricks where they get blood.
Yeah.
What type of a unit is that?
Oh gosh, I don't even know. I mean, I'm not doing that every day as a PT now, so I'd have to go back and look at all the numbers and everything. But from what I remember, it was your body produces a certain amount of lactate in the blood as you exercise harder, and there's less ability to get rid of the lactate. So as it builds up in the blood, you start to have, higher numbers. I think it's like you want to have something less than, this could be wrong, but like anything over 1.2 or something is like, okay, your body's starting to get into that that lactate threshold where you have this range where you can successfully run in that, but once you go over that, you're kind of burning more energy stores than you want to be burning.
Right.
So
Which you're going to lead into muscle cramping and fatigue.
Yeah.
But it has to do with the pH change becoming more acidic in the body, not being able to regulate pH well. And then obviously if you're in a state of more acidic or alkaline levels, your body's not going to function as well, and that just presents itself as fatigue. But the actual unit itself, like how do they have, because you have the blood glucose monitoring units that you just prick your finger, you set it on the unit. Do they make something like that?
Yeah, it's kind of like a yeah, you just like stick it on your finger, and then there was a little, I don't even know, I think it was just like it looked like almost like a little diabetes like pricker. Yeah.
Okay. Well, we're gonna have to look into that, because that might be something that we could just implement here with training and athletes.
No, it's pretty cool. Yeah.
Depending on how much they cost, but I didn't know that they had small units like that. But it's a very scientifically driven thing, because if you know your levels well, you're going to be able to perform better, or especially in the long distance, because you want to get right up to that threshold without crossing it, because then you can ride that level for a long time before you run into fatigue, muscle cramping, and all of the symptoms that go along with it.
And sometimes cool. our brain tells us we're running too hard when maybe we're not, right? Or vice versa. It's hard to sometimes listen to your emotions, because running's painful. So it's nice to have some numbers to be able to go off of. And I'm a pretty analytical person versus like a, I guess, like go off of feelings type of runner. So it was helpful for me. You know, I was usually that type of runner that was back in college. I've learned a lot since then, but I would, if I had a 3-mile run, like easy run that day, even if I was cooked, I would just go out and do my easy 3-mile shakeout. And I think sometimes it is good to listen to your body, but I was kind of like go by the numbers type of running. So,
but it's important to have a good mix of both, because if your body going off of heart rate and all of these other statistics, you had excellent sleep, overall your body's telling you that you're recovering well, but your mind is just not there, it's still okay to go for a run, because everything is in line, and you need to continually make progress and push those limits. And I think our mental state is more limiting than what our body is, especially when you get into consistent training.
I agree.
Body gets really good at recovering, especially with distance, endurance athletes, endurance sports. But take us a little bit into your injury, and we can start talking about how you kind of overcome different injuries with athletes.
Yeah. So I actually was pretty injury free throughout college. It was great. I had one really weird thing happen to me. Well, I guess it happened twice, but I've had 2 lung surgeries, and that's what kind of took me out for a full track season. I think it was my junior year, but that's not really musculoskeletal related, so we won't go too much into that. I was training for
very important though for endurance athletes.
Yeah, and I guess a good differential diagnosis, if you have a athlete present with sharp left chest pain, numbness and tingling into their arm, take them seriously, send them to the ER. Yeah, so that's my 2 cents on that. Don't just tell them they have a rib, like a muscle strain in their rib, and that they need to take a week off. Anyways, my 5th year, I was training so I took a redshirt season because of that, right? So my 5th year, redshirt year, I was training for the 10K, and this was in the height of 2020. So March 2020, I was about to run my first 10K. I'd been running about 60, 70 miles a week for, several months to get my fitness up. I was ready to go, had got my Nike Vaporflies and all of that. And COVID, March 12th or whatever, said, you guys are going to go home and we don't know when you're going to come back. We're going to cancel your first race. And then it ended up being where my whole track season was canceled, obviously, because of the pandemic. And I did not know what to do with myself. I was finally like done with college and I was at home. I had like none of my friends around and I was just running and I was running and I was running. And I was back in Washington. And eventually, I think, so that was March. In May, early May, I got a stress fracture in my sacrum. I think there was multiple causes of the stress fracture in the sacrum, but I eventually got it diagnosed and I had to take, I think it was, 12, 16 weeks off of running. And so that happened then, recovered, got back to running. And then just this past year, I had another stress reaction in my sacrum on the same side. And then a couple months later, had another stress reaction on the other side. So as a PT, you're probably wondering, well, you're a PT, why can't you fix this yourself? It wasn't until I actually worked with a really good PT, excuse me, and she found out my L5S1 was locked up. Like my low back was just not good. She said it was crappy, I think is the term she used. So she did a lot of mobilizations in that area, got everything moving like it should be. And she kind of fixed my biomechanics with that. And, L5 innervates gluten med. So my L5 was locked up, nerve compression was happening. If I tried to do a single leg squat, single leg RDL, my knee just automatically went in. It didn't matter how much glute activation I did. People would say, strengthen your glutes. I would strengthen my glutes. Nothing would happen. Sometimes we don't just want to strengthen. We need to, in this case, it wasn't going to matter how much I strengthened. That muscle was not being innervated. It was just non-existent. So all of these years, my glute med on my right side, for whatever reason, well, we know now, was not active. And so I was just getting loading into my sacrum step after step after step because I wasn't stabilizing. My hips weren't stabilizing. So it wasn't until I had somebody actually really work on my low back, open up lumbar spine to allow the nerves that innervate those muscles get to the muscles, I could actually start working on my glutes. So I think it just kind of shows that sometimes we think we know what we need to do to treat injuries, but if you don't really get to the root cause of what's going on and why, you might just have this repetitive cycle of re-injury and re-injury. And you might think, okay, I'm doing all this glute strengthening. Why am I not getting more muscular shock absorption when I'm running? Why am I not loading, why am I not, why am I keep getting stress fractures?
Right.
But for me, it was like, it wasn't even a matter of, can I get my glutes stronger? My glutes weren't even awake. I had to get my back unlocked in order for my glutes to be working. So,
which is important. So being a PT, everybody is like, hey, you know how to rehab your own injuries.
mm-hmm.
And yes, I am. And yes, I can.
Mm-hmm.
But there's the factor that I can't do mobilizations
Mm-hmm.
on L5 S1.
Mm-hmm.
I can't do any of that with a foam roller and something, but to have somebody else look at it
Mm-hmm.
is a large factor that is going to improve my outcome measures myself.
Mm-hmm.
So that is a very important thing. So like
Mm-hmm.
where you were talking about, the basics with, yes, I can go in and strengthen, you're
Mm-hmm.
missing a large circle of information. You're not looking at the entire system and how it functions. So your
Mm-hmm.
outcomes, naturally, you're probably going to miss something.
Yeah.
And that is important when you go into a rehab plan, because you might be just shooting a dead duck over and over again.
Yeah.
And not getting to the actual root cause of the problem.
Mm-hmm.
So the fact that you had somebody else look at it, they diagnosed a different problem that could be leading to your symptoms, your stress fractures. It's not a very common place to have stress fractures or stress
No,
reactions.
I mean, it was really alarming to the doctors because at the time, like 23, 24 year olds, am healthy. Unless you're a distance runner, it doesn't make any sense to have a fracture there.
Yeah,
So, I mean, I think there's other things that go into stress fractures, vitamin D levels, optimal bone
nutrition.
density,
Yeah,
nutrition, all of that sort of stuff. But I think a big part of it too is just the repetitive loading of the bone and not giving the bones enough time to adapt to the new stresses, things like that.
have you ever run into symptoms of? I think they call it something different now, but the female athlete triad.
Yeah, definitely. When I was, I think, starting like my senior year of high school to my freshman year of college, that's a whole nother story that we could dive into at some point. I was running really well. I, entered college and I was just on this roll. And, for me, I was in like a vulnerable place as an athlete because my old coach was celebrating the fact that I was doing so well. I was one of the top runners on the team, but I was losing weight, and I was very lean going into college. And the fact that I think I lost like 10 or 15 pounds from the start of the season to the end of the season, my freshman year. I was never diagnosed with an eating disorder, but I definitely had an eating disorder. I was um, very malnourished and had a lot of effects years later. And I think part of the stress fractures could have been from that freshman year. After freshman year, it was really hard because I ran amazing freshman year. I won our conference and in track, and I set my PR in the 5K. Dropped 40 seconds in the 5K from like cross country to the indoor track season. It was
Nice.
crazy. I say all that as like from the outside looking in, you could say, "Wow, like you're so awesome." But it was a destructive environment because nobody was looking out for me and saying, "Hey, you're not doing this the right way." So then, a few months later, like I think my sophomore cross country season, I ended up getting just like a small injury, and then uh, was battling injuries, just like small injuries, not like bone injuries, but just like small muscular injuries. And then I went through a period where my body just was like, oh, we can't take this anymore. And I think I gained more weight back, and I was like struggling again with just kind of that whole cycle of I was running well when I was super underweight, and so now I'm
Yeah.
wait. And it took until my senior year until I started running times faster than my freshman year, but in a healthy state. But I'm really passionate about that, like Reds awareness, and how so often especially I think female athletes get in this mindset of thinner is faster, and that's just absolutely not the case. And you can be so much better and have so much more longevity with your career if you do things the right way and not just overtrain, under fuel. You have to have healthy hormones. Yeah, I could go into all of
Yes.
this, but
Yeah. Well,
it's a
and
whole
just
story.
if the way that I think about it and preach to all of my patients and the athletes that I work with is you need to optimize your body for the best cellular function.
Hmm.
If you can do that, your body's going to do its job. You're going to heal faster, recover faster. And if you can do that, then you're going to be ready for the next whatever it is that you want to put your body through. So
Hmm.
you need to be doing all of those things right. It's not as much about the workouts that you pick and choose.
Hmm.
It's how fast and when is the next workout. Like how fast can you recover before the next workout?
Yeah.
And
Yeah.
yeah, there's a lot to, talk about doing the right training principles, but
Yeah.
if you're doing the things in the background, you don't run into problems like this. Your body doesn't hit fatigue, burnout, and a lot of times what the outcome is a stress fracture
Mhm.
or other sort of injury because the body hasn't healed itself to come back stronger before the next workout. You just continually have breakdown after breakdown,
Mhm.
results in injury.
Yeah.
So if people can recover That is the number one important thing
Yeah.
for an athlete.
Yeah. I think it's super important too that coaches are aware of this and just have the athlete's longevity in mind. I think a lot of times with college athletes, there's such a push to get back for the next race or, in any sport, the next game or whatever it
Yeah.
is. And we're still in this mindset of not thinking about 6 months from now, is that going to be the best thing for the
Right.
athletes? I think it's important that you put the longevity of the athlete in mind and just kind of think, okay, is this really going to be best for them if we try to have them push through this injury just for this race? And sometimes it is worth it. Sometimes
Yeah.
it's the regional meet, and you've been training 6 months for it, and you're having some gnarly knee pain. I would say just like race through it. Yeah, don't take off. But I think there's always that risk versus reward.
And the whole factor of pushing through whatever pain that you have, it's still important to get that looked at by a professional.
Mhm.
I always say physical therapy is that professional because we spend the most time with people and we do the deepest dive, and then we can point them and yes, it looks like a fracture. Go get this imaged,
Mhm.
or this could be a tear. Go get imaging,
Mhm.
or whatever the structure that is involved. Or we could say, yes, this is going to be painful, and if you want to compete, go for it,
Yeah.
because I don't think you're going to do more damage to it. And that's the difference. Otherwise, people run into a significant injury, then they're out for the season.
Mhm.
And it's a lot harder to come back from something like that than it is to just take 2 weeks of recovery time with specific rehab and heart, lung, all of that functioning. You don't lose muscle mass. Everything is tip top shape because you've been prepping for the return to sport, but you haven't lost a lot.
Mhm.
When you run into injury, you lose a lot before you come back, and then it's your body's ready to go from the injury site because it's healed, but everything else has been deconditioned. So now we still need to build back up, and strengthening can take 2 to 3 months to get you back to that return to sport
Mhm.
uh, position.
Yeah, I agree.
All right, break us down into some methods of returning to sport or working through injury.
Yeah, so I think a couple things. One thing I think is a little bit outdated is the idea that we need to stretch more. I'm all for stretching. I think, there's a time and a place for stretching, but I think in a lot of cases, especially with athletes, we need to load more. So the reason you got injured in the first place is because the tissue, whether it was like your tendon or it was muscle, it was not strong enough to tolerate the load you put on it, therefore you got injured. If it was a repetitive, let's say running is a very repetitive sport. If you're continually just loading that muscle, or I guess running, using that muscle, but it's not strong enough for that task, it's going to get injured. So, kind of along that lines, a lot of times when our muscles feel really tight, it's because they're weak. So, your hamstrings are really tight after a lot of running. Well, your glutes are probably weak because if your glutes are weak, you're going to be overusing your hamstring. So, anyways, I could go on about
Yep,
that.
yep.
So I think a lot of times loading appropriately and heavy enough. I think we're sometimes afraid to load heavy enough in single leg exercises. So let's say it's like a hamstring. We'll just go off of that. Instead of just constantly stretching your hamstrings before you run, I think it's important to have 2 or 3 days a week where you're in the gym, probably working with a PT would be preferred, doing like single leg RDLs where you're slowly loading that hamstring into a lengthened position. That external load is going to help, it's going to increase the flexibility of the hamstring, but it's also going to be more sustained versus just stretching it and then it's going to not really make a lasting impact. So, loading heavy enough weights, single leg. So, if you have an injury on one side, you really want to make sure you're looking at both sides of the body. What's the difference between my right quad strength versus my left quad strength, really looking at your biomechanics with single leg squats, single leg jumps, all that type of stuff. What's the difference in that?
Yeah, there's a couple really important things that I want to touch on. The first one being running is a single leg sport. So if you're not training single leg, you're doing yourself a disservice because you never are running. Like the definition of running is you have one leg on the ground at a time. If you're walking, there's a period of time where you have double limb contact, but there's a period of floating through the air, and then one leg is touching the ground, and then you're floating through the air, then the other leg touches the ground. So training single leg is amazing. I love the RDL.
Mm-hmm.
Again, when you're working single leg with the RDLs too, you're getting glute pelvis stability. You're controlling that entire system. You're working on balance. There's a lot of other factors that you're mixing in with just that hamstring specific focus, and it's an eccentric exercise.
Mm-hmm.
I love that you picked that exercise because you're doing so much all in one.
Mm-hmm.
And to have the PT, yes, we're biased and we think you should be working with the PT. Physical therapist, not a personal trainer, even though you do have good personal trainers, but really finding the PT that knows running, knows the sport is going to be different than, say, if you're just seeing somebody generalized that sees hand, wrist, elbow, all neurological conditions, but the majority of their caseload is post-operative geriatric adults. Completely different specialty, so they're not going to relate to you as well as an athlete. But one other really good exercise for the hamstrings and preventing hamstring injuries, along with the eccentric component, is the Nordic hamstring curl.
Mm-hmm.
So it's you're pretty much just working the opposite direction. So rather top down, you're working from bottom up, and that exercise has been researched by like 8,000 something athletes and can reduce injury onset of hamstrings by up to 51%. So if you're not training the athlete, I literally just made a post about this 2 days ago. But it's crucial to be breaking down specific muscle groups, and hamstrings, it's usually the eccentric or the deceleration component that people get injuries. So
Yeah.
if reoccurring injuries with the hamstrings, definitely RDLs is an excellent exercise. Hamstrings are an excellent exercise. And I love that you brought up loading. That's like the number one push for all sport physical therapists is we need to just get everybody underneath weight, challenge muscles in different ways, but making it hard. Not something that you can do 20 to 30 reps in, and yeah, it's fatiguing, but I could also probably do another 20 to 30 reps. That's not enough load. We're talking 8 to 10, sometimes even less. We're not building power, like we're not turning ourselves into bodybuilders, but it's still very important to, if the goal is to hit 8 to 10 reps, then you can't do 11, 12, 13, 14 reps. You have a weight that says, nope, my body will not do more than 8 if that was the goal, or 12 if that was the goal. And that's big in recovering with injuries. So I love that you brought up those points, and those are my little tidbits.
Like
also
going
with the
till
stretching.
I was just going till failure. I think a lot of times people are afraid of, but that's how you get stronger. Our bodies need a high stimulus in order to adapt and change. So don't be afraid to go towards failure with your reps and really start feeling like you can't do it, because that's how your body's going to change and adapt. And then another thing that I was going to touch on too is just how you said those exercises are functional. And I think a lot of times we do a lot of isolated exercises, or some PTs will do a lot of isolated exercises like a clamshell, but you need to get them in like the running position and see how their body's activating those muscles in a functional position. So you want to be standing, you want to have your knees bent, you don't have your hips level, and then now single leg balance, now try to do the clamshell. Well, while all of that is going on, are you still able to appropriately activate the right muscles? Because you could be laying on your side activating your glute all day, but can you do that in running? And so that's kind of one thing too with my whole stress fracture recovery was, once I got my glute activated, okay, now how do I actually use it? Like, how do I actively use it? Because you can strengthen it all day, but is it going to be active at the right times, and is it going to be actually working? So.
Love that. Absolutely love that. It's the motor control factor of what we do. Does your body all activate at the right times to biomechanically put your joints in the right positions throughout whatever the activity is that you're performing? And in our case, it's running.
Mm-hmm.
So like the single leg squat is an excellent exercise or a test, because if your knee drifts inwards, guess what? Glutes aren't functioning to maintain proper alignment. That can lead to patellofemoral pain syndrome, IT band syndrome, other wear and tear on the joint, foot, ankle pain. And it's just, the list goes on and on. So just having the biomechanics and the function of the muscles, that motor control working at the right time, a large factor of what we do, neuromuscular reeducation as PTs. Another reason why we're very biased. We can talk circles around a physical or a personal trainer about all of that, because we have a large medical background, and a large portion of our studies go into anatomy and biomechanics.
Yeah, I think one thing I was just thinking about is treating tendon injury. So if you have like Achilles tendonitis or patella tendonitis, there's a little bit of a misconception about like how hard you do have to load those tendons. I've been doing a little bit more research on that recently too, just to kind of
Fill us in.
my knowledge. So when you're coming back from an injury, not like, so we're not talking about like a tear, right? We're not talking about like Achilles tendon tear. Like obviously you're going to get, probably going to get surgery for that or repair. But if you've just got like a tendonitis, so, just some pain in your Achilles with running, or pain in your patella tendon with running, so you're not going to get better from resting, right? That's kind of the outdated mindset, is just, okay, rest it for 6 weeks and then go back to your activity. You want to actually load it enough to where your pain is like a 3 or 4 out of 10 while you're doing it. That's the research on that now. You start with isometric. So for patellar tendon, you want to do like wall sits. And then if you're able to do that successfully, then you start doing single leg squats on like a decline, like a slant board decline, and you're going knees over toes. A lot of times people are afraid to go knees over toes, but you're going to kind of push into that pain because that's going to strengthen that tendon. So things like that are just interesting, right? Like I'm learning more and more about the physical therapy every day. And that's just something where I would have never thought that you want to be pushing through pain, because I think when I first started, which I'm not that far along in my career, but it's like, oh, is there any pain with that? Oh, okay, let's back off. Okay. So don't be afraid to tell your patients, hey, this is going to be painful, and it's supposed to be painful. And that's okay. I think that's sometimes a fear of both patients, and sometimes we fear putting our patients through pain too, but it's normal. And the patients may not like you, but just tell them that's how they're going to get better.
This is where you're at. You're safe to move it. And we have that education up front. Now we need to load it, just like what you said. And if you can controllably load a joint, you're going to, especially if you're pushing towards near failure, I kind of break it down to be something along the lines of dry needling. You do dry needling?
We have to get 70 hours in Washington. I'm at 20.
Like of what?
Of courses. So I've done 20 hours of Con Ed.
70 hours of just
hours,
courses?
and then 150 hours of supervision. So it's going to be like 4 years.
They just not want you to do it.
They don't want PTs to dry needle. Yeah.
Yeah.
Hopefully the board of Washington's not watching this, but kind of the worst.
Well, who cares? It's ridiculous because we have all of the background to
Mhm,
be able to do it safely and effectively, and there's certification courses that we all have to go through to legally be able to do it,
mhm,
and it's a very safe practice,
mhm,
like with our education. But yeah, anyways, with that, you create a large chemical change. There's a neuromuscular or a neurological involvement as well as muscular change, but locally at the site you create an inflammatory process because there's micro damage. You're sticking a
mhm,
needle through somebody's skin, and after that, you create damage.
mhm,
You the body has a natural occurrence to healing after that. We can do something very similar with loading a muscle. Because
mhm,
what happens when you have delayed onset muscle soreness? Your body has micro tearing from an injury, and you create a large influx of healing properties
mhm,
to the area and also flushing out everything that was there. That can also be very helpful with people's pain and healing injured sites, or something along the lines of a tendonitis where there's not an actual tear there. It could be more chronic. It's like, hey, we're going to load you up. You have chronic back pain and you haven't lifted weight in a long time. Guess what? We're going to do some weightlifting, and I guarantee you in a month of doing this, your back pain is going to be relatively nothing.
mhm,
Well, we want to address everything else that's going on as well. It's not the only thing that's going to make people better, but most of the time, if you just implement a large loading structure, and this is pretty much neck all the way down to feet, you're going to have a positive reaction to that area.
mhm. Yeah. I think there's a part of that too where people are afraid to load. Let's say people have gotten a back injury from squats. I feel like I have heard a lot of people that are just like, I just don't do squats because it's gonna hurt my back. Well, that's not good.
Yeah. Yeah.
That's just some misinformation that people like think that inherently squats are bad. You know that you just have to work with somebody that's going to help you get your right form. They're going to progress you at the right rate. I think there's just a lot of information about like how to progress and load someone, right? But I think there's always like a lot of people have like just an innate fear of an exercise.
Yeah,
Let's avoid it.
it is. Well, you lift something, and for especially our the generation above us and getting into our parents, they're very educated on if it hurts, quit doing that.
Mhm.
And it's so hard to like re-educate that because it's ingrained into them, and then
Mhm.
they go their process has always been go to their medical or their primary care provider, and some of them, yes, they have a different education, but it's not more than what we have.
Mhm.
And if you have pain with movement, like we are the specialists in that area,
Yeah.
us or an orthopedic doctor of some sorts. Like we are the people you should see, not your primary care provider. They're good at saying, okay, you're gonna need this medication,
Yeah.
and to go to physical therapy.
Yeah.
It's like, well, just come to see us anyways, or like in the first place.
Yeah.
Just insurance doesn't allow that to happen. So unless you go to an out of network care provider. We talked a little bit about training while injured.
Mhm.
Talk to us a little bit more about that and what a good structure is, because especially with the running population, if you have any sort of injury and you go to the wrong person, the general rule of thumb is just rest it.
Yeah.
We talked to, and you mentioned that. What should people do instead?
Yeah. So I like using the analogy of if your car breaks down, you're not going to just put it in your garage until it works again, right? Like it's not going to get better. So you need to take it to the mechanic, just like how if you have an injury, you need to go figure out why and get help for that. So obviously depends on the injury, right? If it's a bone stress injury, you're probably going to be a little bit more conservative than if it's a like a ligament, like ankle sprain or tendonitis, things like that. Um, I would say, making sure that you're you're going to somebody that's going to help kind of show you, okay, this is why you got injured. And then let's figure out why the tendons or the ligaments or the muscles, was it a repetitive injury? Was it like a one time too heavy stress on the muscles, ligaments, all that? And then let's dial it back and let's start loading, so find out the areas that are weak and start trying to slowly progress the load. You might have some asymmetry side versus side, start loading single leg exercises. And it obviously really depends on the injury. If you have a bone stress injury, you're not going to start doing plyometrics, right, as you're healing. But you can, if you have a bone stress injury, you can start strengthening your bones, right? Like that's probably going to be one of the best things you can do, is start doing some resistance training. Obviously, you don't want to be doing exercises that are going to irritate the actual fracture. You want to let that run its course and heal. But you can start, let's say if it is in your sacrum, you can start doing lots of like glute med strengthening, your band walks, your functional clams. You can do all sorts of exercises like that. That's kind of what I was doing in my recovery process. And then, yeah, I would just say work with a PT, because you know what to do.
Back to us.
Yeah.
Yeah, that's really good. And there's a limitation to what we can and can't do when it comes to initial onset of injuries. But even having that conversation with a PT, even if you talk for 60 minutes with a PT, you get right down to what exactly does it feel like? Where is it located at? What caused it? How long has this been slowly building to get to that point before it's like, hey, I can't run anymore?
Mm-hmm.
And then you make a collective decision together on how we move forward. Is imaging necessary? Because there's a lot of times that people have stress fractures as well. In acute stages of stress fractures, sometimes up to 3-4 weeks, that they don't even show up on radiographs,
Yeah.
your x-rays.
Yeah.
So the process of training, it's like, well, we don't even need that information.
Mm-hmm.
We just need to know that, hey, there's probably a good chance that there's a stress fracture here, so we're going to allow the bones to heal, but load and strengthen as tolerated until we get outside of those healing times, which 8 to 12 weeks is a good range for any sort of bone injury itself, depending on what, say more for fractures. And sometimes, it's a good rule of thumb for strains and sprains, but sometimes those take a little bit longer. Just depends on where it's at in the blood supply that is to the area. But it's still difficult. Coming back to the limitations, is we can't see inside the body. So sometimes it's good to still talk to the PT, go through all of the information, and then yes, we want imaging, or no, I don't think imaging is necessary. I just had a athlete that was about a month, so 4 to 5 weeks ago. He's been dealing with wrist pain. It was falling on an outstretched hand. That style of injury, but it somebody ran into her wrist playing hockey. So you still have that foosh injury. So pretend you're falling straight forward, and then you land on the ground. So there's a lot of potentials in like a scaphoid fracture, and that one you're very nervous about because of the blood supply to that area. And then you also have like distal radius ulna that could be potentially fractured or injured. And the fact that she wasn't getting better and still continuing to play sports, it's like we can, there's nothing displaced. So we know that doing some movement all through a pain-free range of motion is going to be likely. So if there's nothing displaced, I don't see it in urgent need that you need to go get x-rays.
Yeah.
But at the same time, things are getting worse, so we should probably limit what you're doing, especially passing, shooting, playing hockey, because if you were to injure it again, you could have something very bad happen.
Yeah.
And then when we got down to, after talking through, and she's an athletic trainer, her mom is,
Mhm.
so very highly educated too in the musculoskeletal space, and they we decided together that it would be a good idea for her to go get X-rays, especially if she wanted to play this weekend.
Yeah.
Uh, so it's like, hey, rule that out, and if there's no fractures or stress to the bones, uh, then it's like play as tolerated with support. You're I would have been okay with that. So they went and got the imaging, and it was relatively inconclusive, but it shows slight healing that is consistent with a Salter Harris fracture.
Mhm.
So in the young young youth, children, growing people, they a Salter Harris fracture is something to do with the growth plates.
Mhm.
So a fracture with the growth plates, and we want to make sure that those are taken care of with the utmost caution. Um, and she talked to another ER doctor with the information that they had, and he was
Mhm.
pretty much like, don't play. And
Yeah.
I was leaning along the same way, but the athlete in me is like,
Yeah.
you want to be cautious with that, but I'm not going to say not do it,
Yeah.
but at the same time, we want to be really careful with,
Yeah.
anything that's relevant with growth plates or correlating with growth plates. Uh, Otherwise, you're looking at long term. It's just 13, 14. You're looking at life of wrist problems if that doesn't heal up properly.
Yeah.
So there's a lot to consider and think about, and you touched on that earlier too about having coaches and athletes looking at the longevity of their athletes, and
Mhm.
that's a big thing. Even though you have to take the short hit of, yeah, maybe your best runner is going to be out for this meet or
Mhm.
the next meet, but they're going to be here for junior, senior years, so let's get them back healthy
Yeah.
and look for long term, and that's for sports, all across the board, especially contact sports.
Yeah.
Um, you see it all the time in hockey where your number one players, your first line, they're they want to play and they want to work through everything, and the coaches are usually the people that have to hold them back, and a lot of times they don't, and then they're out.
Yeah.
Like, poor decision.
Yeah. Yeah, being an athlete myself, I think I've definitely been one of the types of PTs that's less conservative. I'm like, I'm not going to tell you what to do, even though I probably should tell them what to do
Yeah.
because I know myself. And I know that when I was younger, if I were to work with like a doctor that was like, don't run, I probably just ran anyways because I was like, what do they know?
Yeah. Yeah.
I definitely feel like there is a, a fine line of making sure you educate someone enough on the risks of something and maybe allow, depending on the age. If it's a kid, obviously you're probably going to tell them what to do and tell the parents. But if it's
Yeah.
an adult, I think sometimes it's not our place to tell them what they can and can't do. It's to give them the risks versus the rewards and allow them to make those decisions. And, people are going to do what they want with their lives. And so sometimes I try to, just stand back a little bit, maybe more than I should.
I don't know. It's difficult
Yeah.
to when you don't have all of the information in front of you either.
Mhm.
So the best thing that we can do is just educate, talk through those things with them, and I'm very much the same way of, I'm an athlete. I want you to go play. It's probably something that I would battle through, or would have battled through. And same thing with me. It's like I just ran an ultra marathon, had significant knee pain that started around mile 6, and I battled through and literally couldn't run after mile 15. And when you're running 50.7 miles, or like that's the length of the race, you can either quit or you can continue to move forward. And with what was going on, I chose to just, I'll deal with the consequences later because I don't
Yeah.
think it's going to be that gruesome of an injury. But I couldn't run, so I ended up walking for 35 to 37 miles. It's
So
still a long ways. And, I had pain medications and other thing on board to get through it. And I'm still rehabbing myself from that. But the way things are healing, I'm stressing things appropriately now to progress, because I run into people all the time that saw me on those days or like that day and were a part of like our group that went to the run.
mhm.
They're like, wow, you bounced back pretty quick after that. Like, well, I've been doing everything that my education has been telling me to do. It's just,
Yeah.
I can't run any more than 3 miles now without excruciating pain again, and then a couple days of rehab. But it's the slow progress to get back into it, because I don't want to lose the benefits that I have put in over the last 6 months. So
Yeah.
I'm pushing back into it. So I don't know,
Yeah.
long-winded story. When you still have that athlete mindset and how important it was to us to still play, especially in a team sport. It's more individual. It's easy to kind of pull the plug and uh, look for the future. But when your whole team relies on you, it's difficult for us too to pull somebody out of that position.
Yeah. Yeah. I think I might be scarred a little bit from like when I was younger and you I didn't want to go to the doctor if I had like an injury or something. My mom would be like, "Oh, let's just go to the doctor." And I'm like, I know exactly what they're going to say.
Yeah.
They're going to tell me to just not run for whatever amount of time. And I think that as I've learned more in this profession, it's like I know that's not right. Like that's not the most educated thing to say to someone. It's just, oh,
Hmm.
just rest, right? Because now we know that you do need to do certain things to help prevent it from happening again. So I think part of me is just like, I don't want to go to the doctor because they're just going to tell me to do this. And yeah, I don't know. I think there's a balance.
There is. All right, Dr. Brooke, let's wrap this baby up. Give us we talked about a lot of things. Give us a few takeaways from this wonderful hour of talking about endurance athletes and injuries.
Yeah. So I guess so. We talked a lot about recurring injuries and why do we have recurring injuries? And I think it's really important to take a step back if you're getting an injury repeatedly and ask why, not just rest until it's better and then continue the same activity you were doing. Take a step back, figure out why. If you have to work with a professional, then that might be what's best for you. But if you have to change your biomechanics, you have to get something that's locked up moving. You have to load a certain muscle that's been asleep while you're running or while you're exercising. Go back to the root source of what's causing or not go back, learn the root source of what's causing your injury and treat that. I think that's probably number one. Load, load your body. That's a big one. I think don't be afraid to load. Don't be afraid to lift heavy, but at the same time, be be cautious with that. Don't go crazy. You need to progressively load. But you can always work with a PT if you're not sure exactly what that means. And then let's see, what would be my last one? This is kind of random, but don't just do single plane motion movements. Do lateral movements.
Ah,
Do stuff in other planes because running's a very unilateral sport. And if you're just doing front on exercises and just like things that are going to load your hamstrings, your quads, your glutes, like glute max, you're gonna get injured. So load into different planes. That's kind of random, but it's
we could have a
my
whole podcast on that.
yeah.
It's so important. Yeah, that's a huge point to finish on. I don't even want to open that can of worms. Those are wonderful. Great way to sum up the whole conversation. I'm not even gonna to touch on any of that. We'll leave it there. Where can people find you? Because you started an Instagram account. You're building
Yeah.
that.
Yeah, I started an Instagram account. It's just let's see, I think it's just Brooke Ayers DPT. Um, yeah, we're just getting it started. I'm not even sure what my target audience is yet, but I'd love to work with runners and people that are, have goals for endurance sports. So yeah, just feel free to message me on Instagram, and I would look forward to connecting.